All right, so it's now 12:30 and I'd like to get us started with the panel. So first of all, I want to issue a round of thanks again to all of our speakers and poster presenters, as well as Kyle for keeping everything on time and running smoothly. So let's now begin our panel discussion on the role of scientific NLP in an epidemic, which is of particular relevance right now. A quick reminder to attendees to go ahead and type your questions into the Zoom chat box. So for those of you who are just hopping on now, let me briefly reintroduce our panelists. So we're delighted to have Asma Ben Abacha from the National Library of Medicine at NIH. She's a staff scientist who's working on NLP in the medical domain, and during her presentation, she talked a lot about her experiences in organizing medical and consumer health QA challenges and in running various NLP share tasks with the community. We have Hoifung Poon, who is the Senior Director of Biomedical NLP at Microsoft Research, where he leads the Hanover team. And a lot of Hoifung's work focuses on NLP applications in precision medicine, which he also talked about during his presentation. And we also have Byron Wallace, who's the assistant professor, who's an assistant professor at Northeastern University, working in the area of NLP for health informatics. And he's done a lot of work in the automation of systematic literature reviews, where he just spoke about Robot Reviewer and Trials Streamer. So thank you all for participating. To start us off, could you describe how you've been thinking about maybe the promise of scientific NLP as it relates to the current pandemic situation, and whether we're sort of meeting or delivering on those promises? So maybe let's start with Asma.
Thanks, Lucy. So I think this is a good, actually, opportunity for all the NLP community, let's say, to apply all the efforts that have been, and systems and models that have been developed and during all these last years in real and concrete problems that affected a lot our lives this last month. So it was really great for me to see how the interest that people and researchers showed, either by creating data set. You guys were the first to create and propose the COVID data set, and then create challenges such as at Trek, and there are also new challenges right now. And then the researchers from all over the world creating teams, even people who don't work together, they are forming teams and to contribute and participate with all these. It's true that it's a hard problem. It's hard to, but I think we are able at least to, if I think about the question answering problem, for example. So we have two types of questions asked by people like us, and I think system now trained on the data that we have are at least able to answer these kind of questions about what's COVID-19, what are the symptoms, what we need to do, what we don't need to do. So, but also the harder problem of answering questions asked by doctors and professionals. And this is, I think, what's now interesting to see more efforts on analyzing scientific articles and trying to focus on the harder task of analyzing and extracting maybe new discoveries and new information, and link all the information that we can extract from different articles and try to discover new maybe treatments or vaccines or things like that. This is, I think, it's great to see more efforts in this direction.
Absolutely. And I think it's things have been moving very quickly. Hoifung or Byron?
Yeah,
go ahead.
Go ahead, Byron. Sorry.
No, I don't actually have. I was mostly just going to reiterate those points. I think for me, it's been really exciting to see the I guess focus on the potential of using these tools to kind of rapidly respond to to this sort of pandemic. I think hopefully one small silver lining that will come out of this whole thing will be sort of a, I don't know, galvanization of more folks in NLP to work on these problems. And so that's been really exciting, I guess.
Absolutely. Hoifung?
Yeah, I want to echo Asma and Byron. I think first I want to again echo Asma's shout out for you guys at AI2 who created this Core-19, and it's really amazing to see how much impact, right? It instantly has attracted and so many systems are building on top using that data set, also track, release this official evaluation based on that data set. So great work. I think another thing I also sort of want to echo Asma and Brian is like, this really feels like a great opportunity for sort of like raising the awareness for biomedicine and healthcare for sort of the NLP community, right? So I can tell you at Microsoft, like one thing I have been trying very hard in the past since I joined is to trying to persuade other, computer scientists or NLP folks to machine learning folks to, work on the biomedicine. Oftentimes the natural reaction from them is like, well, it seems like such a messy world. It's more comfortable to stay in the more mainstream topics. At least we can understand the text and so forth. But I can definitely see like COVID actually feels like a catalyst that actually now we are so almost slightly so like there are so many people reaching out to say, hey, like can we collaborate on this topic? So we actually have some pretty exciting internal collaboration centering around biomed NLP, and so we have some efforts specifically for the COVID that we hope to hopefully next month we can actually release some of those results. For COVID specifically, but also I think some of the lesson over the years for biomed in general is that we learned that actually the first thing to figure out is actually less about should we use BER or T5 or something, right? But more actually about what is actually a key problem, right? So sort of like really also, Asma and Byron really touch on like to figure out who are the stakeholder we are trying to help, right? So
absolutely.
And so for COVID in particular, like one thing we find quite productive is that we have some conversation with the Cleveland Clinic folks, and they are pretty generous to share a bunch of sort of like what they think are the useful, meaningful query. And if you look at them, each one is basically a mini proposal, right? And one immediate thing we realize is that conventional search engine completely break down, right? So if you run those on the PubMed, it barely return anything, right? So
that's right.
So that really sort of point out something like, I think there is sort of like in the intersection between sort of information retrieval and core NLP, so like this kind of biomed search and NLP, I think there is sort of
right. Yeah, I think all three of you sort of alluded to this, which is, a lot of people here have been working in bio-NLP for a while, but this is a moment in time where a lot of new people are being introduced to these problems for the first time, and they're seeing these problems for the first time and how difficult it is to work in this field. But it's also a great moment to try to recruit some of them to these very important efforts. So maybe you can, kind of leading from that, what are some suggestions you have for like working with, partnering with like medical experts and clinicians on these challenges? Like how do we foster these connections between the NLP community and these experts? Maybe I can ask Byron to comment on this first.
Yeah, sure. I mean, I think for me, I think it's been, and some of it is just, at least initially, it's just luck, right? Like I think a lot of times with collaborations, like you just end up, I just keep stumbling upon these really wonderful collaborators. But I guess more seriously, I actually don't think that's a huge problem. At least in my experience, I have more sort of medical folks approach me than I can that I can actually work with, right?
Mm-hmm.
I think so I think there's a huge demand, and one of the things I really love about working on these problems is just the utility, because like I'll go to like the Cochrane meeting or something, I'll be like the only computer scientist there, and they really, like, a lot of the stuff that they have to do in terms of like making sense of literature, for example, they really want to not have to do it. And actually, even on the electronic health record side as well, right? Like, there's just so much. They don't want to. They would love to have a system that would make these things less painful for them. And I think we can do that in NLP. Like, I think so. I guess what I'm getting at is just, I think there is like a lot of demand, at least in my experience, from the medical side, and maybe trying to establish venues where both where folks from both communities show up is a little bit difficult. I'll give a shameless plug for, that's one of the things we really try to do at Machine Learning for Healthcare, which is a small conference that we run, is we really try to bring folks from different areas in machine learning, broadly construed, and physicians together to actually work on problems. And so if you're interested, folks should check that out. We're gonna, obviously it's remote this year, but we explicitly kind of have opportunities to get matched with kind of physician collaborators if you're interested in that kind of thing. So yeah, so I guess, I think there's a lot of demand out there, and maybe others can comment on this as well, but I do think one challenge that I've found, and I think probably we've all faced this, is a lot of times the most useful thing you can do for the physician collaborator is not the most interesting thing. Like, that's not the thing that's going to get you an ACL paper, right? And so I think for me, there's a lot of thought that goes into like, okay, I want this to be both interesting, potentially methodologically, but also useful. And like, maybe it's a little bit hard sometimes to pick those. That's maybe the hardest part about collaboration for me, but maybe that'll change. I don't know.
Yeah, very interesting point. Mm-hmm. Asma, Hoifung, would you like to comment?
Yeah, I can maybe add a few things. So I think, so first, collaboration are very important. And like, I saw very few maybe efforts where that have been made only by scientists, like, let's say, in creating questions or data about COVID with any doctors being involved in the work. So, but yeah, mostly I think people now and scientists are aware of the importance of communicating with medical professionals. So, and I think there are several levels. First, defining and choosing the task to work on, and then deciding what are the areas that scientists and doctors will work on. Is it more creating data? Is it more evaluating the outputs of the created systems? Is it more defining, as I said in my talk, what is a good training data for that task, or what's a good test set to evaluate the system developed for that specific task? So I think and especially that, we have different criteria, we use different languages, right? So we need to be clear on what's the task that we need to work on, how can each of us contribute to it. And if it's, for example, an annotation task, defining the guidelines, annotating a subset, and then meeting and talking and discussing what we have, that the guidelines on that specific subset before continuing the collaboration and the annotation, because we know doctors don't have too much time, so it's very important to define things very well to avoid wasting time, and then maybe have better results for that collaboration.
Absolutely. So it could be fair to say that the question is maybe more how best to use the medical experts' times.
Exactly.
Yeah.
Yeah, maybe I will chime in with a couple additional points. First thing, I will sort of re-emphasizing that this is really a good time for NLP folks to jump into the field. I remember a bunch of years ago when I first started, I go to some of the biomed conference. People don't know what NLP is. I have to spell out natural language processing. And then they will ask you, do you mean text mining, right? Nowadays, if you go to the NLP conference, if you mention you're NLPer, and they will really try to grab you as a collaborator, right? So, so this is sort of, and partially that's because of bunch of the disruption happening in medicine, right? So the EMR really is not a thing 10 years ago, right? I mean, we have maybe 10% of adoption. Now it's like universal in US, right? So that creates lots of text to extract information from. Things like omics really sort of like make it, you really need sort of like a PubMed scale sort of extraction. For example, in the old days, cloning a gene will take 6 months to 2 years, right? So you could build your whole career starting a single gene. So you can afford to read all the 5,000 papers for that gene, right? But now all of a sudden you got, high schooler can get you 20,000 gene in the afternoon, right? So, but nobody can memorize all, all those facts. So that really poses a serious need for the field. One thing that I saw like in my own experience, I think also related to Yoav's question in the chat is like, initially I was super naive when I first get in the field. I expect, okay, I go to conference, I ask some doctors or medical folks, and they would tell me exactly what I need to do, right? Turns out that it usually are not like that, because on the other side, they don't know what we can do. So usually they have a pretty dichotomy view about what AI is, right? On one view, they tend to think of it as like IT++, right? So can you show 5 results, 50 results instead of 20 results, right? That kind of thing. On the other spectrum is like they view AI as like, I mean, you guys can do anything. So I can prescribe anything that currently are done by human. So we learn to actually, we have to sort of get into a little bit of the medical lingos. We need to know enough so that we would actually be able to figure out what exactly is the pain point. But more importantly is to match that pain point to what NLP is capable of doing. Because we are very far from AI complete right now, right?
Right.
So there are only certain things we could help. So it's very important to find that match. But the good thing is that exactly like Brian and Asma mentioned, like once you can find some of those initial beachhead for those match, then the opportunity is just like, you just like in heaven. So
yeah, absolutely. So I think hopefully this addresses the question, Yoav's question, and also Amardeep's question about how much domain knowledge do you kind of need to get started in biomedical work? And if you have any quick follow-ups on that, like, do you have to start from a point where you understand this text as an NLP researcher before you can actually?
Yeah, so one interesting thing Mossam said many years ago when he see one of the PubMed slide is like, he asked, is this English, right? So
oh, no.
it could be intimidating the first time you read some of the biomed tasks. But on the other hand, I think there are a couple things. One is like sort of biology or medicine is really very intimate subject, right? So you learn about that and it's actually useful every day. So it could be very joyful to actually learn about some of those things. Also, David Hackman actually have an analogy that really stuck in my mind. He said, I basically posed that exact question when I first joined MSI. I'm like, David, I'm by no means, I'm definitely a layman, right? So can I make contribution? And he said, well, biomedicine is kind of like a sea, an ocean, but it's only 1 meter deep. So what he means is that it does have lots of concepts, right? For example, you go to UMLS, you have millions of concepts there. But for any particular use case, right? Like for example, on oncology or precision oncology, you could quickly learn enough to be able to actually at least sort of like understand the abstract problem. Right, so it's definitely not like quantum mechanics. Like you need 10 years of postdoc to even understand what the hell is talking about there, right? So medicine is at a very high level. It's pretty easy to understand. So I wouldn't consider that as a big deterring, but certainly I think we as a community probably can help further lower the entry barrier by sort of starting like introducing, like for example, if you look at the mainstream NLP, right, there are tons of those leaderboard benchmarks and so forth, right? There are lots of the open source codes and so forth. So I think for biomed or SciNLP in general, if we as a community can start to come by with a lot of this, you know, benchmark leaderboards, so they can actually substantially lower the entry barrier.
Right, so we can welcome other people using kind of the platforms that they're familiar with. So I'm going to actually interrupt because there's a lot of questions in the chat and kind of turn the discussion somewhere else. I think Shashira asks about what is kind of the role of NLP researchers in kind of communicating science to the public. So we interface with these scientific papers. How like are we responsible for communicating the results to the public?
Results in the papers, like like scientific papers.
I guess the question seems to be just about science communication in general and what the role of NLP researchers is in communicating. So I'm going to reinterpret this as now we have lots and lots of research papers and there's more tools and systems out there that are aimed at kind of maybe helping people find the appropriate papers or summarize the results of these papers. So what is kind of our responsibility as researchers in this task?
I would just two quick thoughts. I don't know if this is addressing the actual question, but like one thought is I think maybe some work on simplification could go a long way, right? Like that seems like a natural and probably doable thing, right? Like I think you can imagine trying to build, you could try to build models that could kind of simplify more technical literature. And there's some kind of found data that you might be able to use. And I guess that's kind of one thing. I guess the only other thing I would say, and maybe this is tangentially related, but something I've been thinking about a lot as summarization systems have gotten quite good. I think if we're going to start doing that, then the issue of factuality in, let's say, abstractive summarizations becomes paramount in a way that it seems like super important, right? Like maybe even more so than, I mean, obviously it's always important for summarization systems, but I think that's like a kind of a really, I'm showing my own biases, but I feel like that's a really interesting potential direction where, you know, sort of enforcing factuality in generated text that might be summarizing, for example, the literature. But I don't know if that was what the question was getting at, so I'll stop there.
No, I think that's a great answer.
Yeah, I would add, actually, yeah, I agree. And I think the scientists have an important role, and right now, especially in defining the research directions in the future and related to scientific papers is through simplifying the language to be more understandable by non-professional or non-expert users, and also fact-checking, for example. And this is one of the tasks that I think we need to work more on in order to at least to check the information that have been published these last months and maybe years in the future, because now people are publishing maybe faster than before, so we don't even have the time to check things. So working on building models for fact-checking and misinformation, I think is one of the directions that's very important, in addition to simplifying the scientific papers for the public, and also maybe working on summarization and summarizing the articles. So I think the role is more on the future direction, and that we need to work on more in the future.
Yeah. Absolutely. And then I think Lingfei had a related question on kind of how NLP, the results of these NLP systems might be used to inform policy. And I don't know if Asma or maybe Hoifung wants to comment on that.
Yeah, so one thing we tend to think, sort of try to dissect the problem is that we try to separate problem into so quote unquote machine reading problem, which is like we take the offer at the face value, like this is what offer said, and then we just extract that, right? So that is actually a task that relatively easy to evaluate, because I mean, you just take anybody who are knowledgeable of the domain, they can conclude whether the paragraph or the text does state something like that, right? But then on top of that, there is a much harder problem, which is like, okay, now you have an ocean of all those offer face value statements, right, from the 30 million papers. What do you make of it? What's the consensus of the community? How much should I trust this more than others, right? Like, I mean, you asked that question. So that part, we tend to attribute that to sort of like the assembly or the reasoning problem. And the challenge for that problem is that it's much harder to get the ground truth, right? So I mean, if you ask, like, I mean, the top scientists, like the top Memorial Sloan oncologists may not even agree on something, right? So that's why we actually start doing a little bit early on some of those, like, for example, knowledge graph embedding and reasoning and so forth. But we sort of, to some extent, retreated back to the safe zone in machine reading because we know how to evaluate. But I think there is a huge opportunity. How do we actually reason about the corpus level belief and so forth?
Yeah, and I think with generative models, it is going to be a huge challenge moving forward in terms of evaluation, how to use these in real world applications. And I don't know if Asma, if the NIH has any policies about using generative models or like the results of generative models to inform policy. Maybe not.
Maybe it's a little bit early now to know more about this, but. I don't have, yeah.
Great. And I think there's just going back to Byron's earlier comment about how sometimes it's hard to find a collaboration where you can both get an ACL paper out of it and get something kind of effective working for the medical community. There's a lot of responses in the chat responding to that comment, essentially. Like,
I don't want to come off being cynical. I still do this stuff because I sort of accidentally got to this, but like
no, but I think it's very valid. Yeah.
Just to be clear, like, there's a reason I've spent like all of this time doing stuff that's in large part not that glamorous, and so I think it's super valuable. I don't know what to say about. I don't know that I have sage advice for what the community writ large should do about it. That's, I guess, not for me to say. But I we've all faced this, right? Like,
absolutely. So it certainly matches my experience, which is very frustrating because I think for the medical experts who want our help, they have a very specific task in mind, and you can actually like change the way they do something in clinic. Right? But then the methods used are just not novel enough or something like that to engage experts in our domain. Very frustrating.
Also, maybe it's good to balance, or at least between doing work that it could be publishable in ACL and good NLP or NLP, let's say here, conferences, but also it doesn't mean that all our papers should be like that, right? So it's we know all that's important sometimes to publish in workshop or in medical informatics conferences like AMIA, for example, because it's there, or MedInfo, because we know there we meet with doctors and medical professionals, and it's there where we understand more about their needs, and they understand and learn more about how can we help to actually change, as you said, what they are doing daily. And I think and it's interesting. So last year I think in the summer, I had ACL, MedInfo, and CLE, so 3 conferences maybe in a month or 2. And it was interesting to meet with the NLP researchers, and then researchers working on medical informatics, and then people from CLE who work more on evaluations. And I thought it's really interesting to continue to meet with and publish these different venues, because this is how actually we learn more and we can help more with what we do.
Yes, absolutely. So we're right at the bottom of the hour. So I just want to close out real fast. Yoav has an interesting comment. I'm just going to read it out loud. He says that if solving real world problems with existing tools is not glamorous enough in NLP, maybe the NLP community should focus on empowering the interested parties to solve the problems themselves. So if we can really quickly, everyone, maybe 1 or 2 sentences on how you think you would empower the interested parties to solve some of these problems themselves. Asma?
So about I think he mentioned the ACL conference. What I usually think is venues like ACL has also an important role to play in this, by maybe inviting more people working on BioNLP and medical related tasks for years. And I think making maybe more workshops where people from both communities can meet and work together and at least exchange their thoughts. So so I don't know if it answers the second part of the question.
Just very quickly, kind of some suggestions. I don't know if Hoifung have last comments.
I think Byron really nailed it in terms of funding and publication are actually 2 potential deterrent for people to actually enter a new territory, especially a sort of a highly specialized application area, right? So I think at least I personally luck out in MSR, because I mean, my first year at MSR, I didn't publish any paper and nobody frowned at me, right? So, but I know that's really a luxury not everybody can have. I think sort of like what Byron or Rioa sort of alluded to, I think I'm actually optimistic that the community, NLP communities, in fact, I think last year's NACO, I actually see a lot more sort of like biomed related paper in the conference than 5-6 years ago, right? Like I suddenly noticed, like I'm like, hey, I'm counting, and there was quite a few papers. So I'm actually quite optimistic. And also I would say, as many of you guys commented earlier, I think COVID also really sort of like jot us out of the comfort zone, right?
Yep.
Many people, many sort of like, I actually heard sort of like from multiple folks, like for example, Regina Basley, right? Like when you start to sort of like run into some of the really unfortunate sort of medical event, that really sort of like put people in perspective. Like, do I want to raise another 2 points for the dependency parser, or do I actually want this thing to help, speed up the next life-saving drugs, right? So,
right.
So in general, I'm hopeful that the community will start getting more interested. I start to see some of the track that people put in some of the NLP conference that are more specific about this application, right?
Yeah, absolutely. There's been way more interest.
And also like workshop like this, actually, I think is super helpful to raise awareness and get like-minded people to join force and so forth.
Yeah,
thank you for your answer. And then Byron, 20 seconds, last comments.
Yeah, no, look, I don't think I have much to add, to be honest. I think it's a challenge. I think that's a great challenge for the community, sort of figuring out maybe what's a sweet spot between being practically useful and also advancing, I guess, the core language technologies forward. But yeah, I'm not sure I have any great answers. I think I'll defer to the prior responses.
Great. Well, thank you all so much for your answers. And I think you're right. The future is bright for those of us working in this area. And so thank you to our panelists. And I just want to quickly close out this session and share some information, and especially for kind of going forwards. So again, really happy that everyone was able to attend. Thanks to the speakers, the poster presenters, the attendees, and the panelists. So just quickly in summary, in this morning, we had 9 excellent speakers, 26 accepted abstracts, with 10 that touched on COVID-19. So this is clearly kind of the topic of the moment. And going forward, for those of you who are interested in these subjects, there's a couple of workshops that kind of fall in line with these topics. So the BioNLP workshop and the COVID-19 workshop upcoming in ACL are great venues to follow up on the work that is being done in this community. Also, the Scholarly Document Processing Workshop at EMNLP is a slightly more general venue that's less focused on biomedical NLP. And there are several shared tasks there that are going to happen on document summarization with some excellent speakers. And please join our mailing list if you'd like to receive future announcements. We will have a feedback form up shortly on our website, it would be great to get feedback from the attendees, especially to inform us whether we should try to host this workshop again in future years. Please reach out to us at SciNLP@googlegroups.com if you have any detailed comments. And again, thanks everyone for attending, see you next year.
Thanks, everyone.
Thanks, everyone.
Thank you.